Thank you everyone for attending today's virtual open house on the graduate programs in population health management. At this point, you should be able to see our first slide. We will be starting here shortly on time. Hello, everyone. We will go ahead and begin the virtual open house for the graduate programs in population health management. I'm Kelly. I'm one of the admissions officers here in the department for these programs. I would like to introduce Dr. Mark Bittle and Anne Yastremski. She is an alumni for the Masters in Population Health Management. Mark and Anne, would you like to share a little bit about your backgrounds?
Sure, thanks, Kelly. My name is Mark Bittle. I am a senior scientist here in the School of Public Health at Johns Hopkins. I've been with the program since its inception. Actually, it was the sort of the founder, creator of the Population Health Management program. Much of my 35 years of healthcare management experience kind of went into building this program from the ground up. And I currently serve as the program director for this program, as well as the Masters in Health Administration program at Hopkins. Anne?
Hello. Yeah, my name is Anne Yastremski. I'm a graduate of the program in May of 2020. I finished the program in 2 years, in case that is of interest to anyone. I live in Baltimore City. I've been in healthcare for almost 10 years now. And I currently serve as the Vice President of Population Health Strategy for a healthcare tech firm.
Thank you, Mark and Anne. Today's agenda will cover an overview of the industry. We'll present program details. The curriculum will also be covered of what you'd be taking in each 8-week term. And we'll share what it's like here at Johns Hopkins with over 20 years of online experience and the level of support that you will receive. Faculty will be presented. And I will cover the admission requirements and financial aid. There will be time at the end to address your questions. So if you have any questions throughout the presentation, please type them in the Q&A box.
All right, well, I'll take over from here for a few minutes and just give you a little bit of background of why we developed the program. First, I want to just thank everybody for taking the time to join us this afternoon. I really do appreciate your time, and hopefully we'll be able to answer all your questions by the end. So one of the, as I said, about 6 years ago, I left the healthcare administration field. I was working in hospital administration, joined the School of Public Health, and one of my last projects was really starting to understand this notion of population health in the health system that I was working for. And what occurred to me at that time, and again, this program was developed in 2017. We launched it in, 2016, and we launched it in 2017, and then graduated our first class in 2019. Is that, our healthcare system, as we know, has a number of issues associated with it, not the least of which it being siloed, fragmented, very costly. But also when you look at the outcomes that our US healthcare system delivers is far below that of other developed countries, particularly those that spend much less than we do. So not only do we spend more, we get less for those dollars, this notion of value. And certainly, the government and many others have come to the conclusion that we really can't continue to exist the way we do and deliver care the way we do, that we really need to shift our focus more towards this notion of value and away from this notion of volume. But one of the things that, was really lacking, I think, in the conversation was, again, this notion of population health. What exactly is it? Why would we want to do this? And I can say, as recently as 6 years ago, people weren't really talking about social determinants of health in healthcare. They were just starting to scratch the surface on it. Today, it's almost, in everybody's conversation, particularly at board levels. But clearly, we needed to think about how we approach managing care better and delivering care more efficiently, more effectively, reducing the per capita expenditures, improving the quality of care, improving the experience of care, all of which in many respects fall within the domain of the health system to look at from a value-based perspective, but also consider this broader notion of populations to look at how are we helping our communities' health to improve. Next slide. There we go. So population health management, what we've tried to do in our program is really bring together the notion of both public health and healthcare. I think if you hit the advanced slide one more time. There we go, one more. And again. Perfect. So our goal was really to, in developing this program, was take the core values of public health, right? This notion of assessment, assurance, policy development, and merge it with what we know from the healthcare delivery side, the focus on the triple aim. Again, improving the quality of care, giving better care, lowering the cost of care per capita, but recognizing that to truly improve health, we have to think beyond just our attributed patient population, but really look at how do we improve health across our communities. And what we realized is as health systems, we don't really have the tools to do that. We really need to think about how do we collaborate with others in our communities to really address many of the issues that are driving poor health, those being the social determinants of health. So our program was built on this notion of creating an interdisciplinary strategy. So we provide courses in this program that come from all the different departments of our school. So we're not only looking at health policy, but we're also looking at statistics, epidemiology, we're looking at environmental health, all of which we've brought together to develop a curriculum to allow us to look holistically at how we can manage the health of a population. And we look at it again from the two vantage points being that of an attributed population, my patient population within my health system, how do we do that more effectively? But also looking across the community to say, how do we better partner with our community members, our community-based organizations to improve health in our communities. So our program is really based on that interdisciplinary nature. And I'll talk a little bit about the faculty in a moment, but first and foremost, it's about building a curriculum that really provides sort of the knowledge base in a very applied and a very practical way for our students to be able to take this information. This program has really been built around working professionals so that you can actually take this information that you get in class and take it to work the very next day and apply it. Next slide. So our curriculum is geared towards two forms of education. One is you could earn a certificate, a graduate certificate. So by completing the first year of the curriculum, which you see in front of you here, you can earn a certificate in population health management. You can complete the certificate in up to 2 years, which means essentially that you could take one course per term. Our school operates on a term basis, which means we have 8-week terms. So every 8 weeks, you're starting a new term. There are 4 of those terms in an academic year. You can also think of it in quarters in a sense, but it's basically 8-week terms. So in term 1, there are 2 courses that you can take, Principles and Applications of Advanced Payment Models, and then our Essentials of Population Health Management. As an example, then you could see Collective Impact and Accountable Care being the next 2, Population and Consumer Health Informatics, Intro to Epidemiology being the next 2, and then the final 2, Statistics and Managing Health Across the Continuum. So you could, the way the curriculum is developed, take 1 course per term and finish the certificate in 2 years. Or you can take 2 courses per term, which is what most people do, and finish their certificate in 1 year. But again, I would just ask you to take a look, at the types of courses that are being offered. Again, we talk about the essentials of population health management. It sets the stage for what you're going to learn really throughout the rest of the program. Advanced payment models really focuses on how we can use payment models to change behavior. And it's not just behavior of the providers, but also behavior of the consumers, the patients, the communities that we're serving. So how do we leverage payment models to actually change behavior, change outcomes? We then look at collective impact. How do we partner more effectively with community members and community-based organizations to effectively drive population health strategies? We look at how to measure the quality of care. It's one thing to measure it within a health system, but we also have to think very differently about how we measure health and health status in our communities more broadly, and merging those 2 sets of measures. Of course, we talk a lot about the need to use data to help us come to the conclusions that we need to improve health in our community. So we focus a lot on using that data effectively through our population health informatics course. You really can't understand, I think, population health well without understanding epidemiology and biostatistics, so that you could really look at not only what are the driving factors behind poor health in our communities, but how do we measure correctly that change in health status over time. And then finally, in our 4th term, we look at managing care across a continuum. So again, many hospitals and health systems have invested a lot of effort and time and money into developing care management programs to focus on their attributed populations. How do we manage that pool of diabetic patients that are within our health system? How do we manage them effectively across the continuum of care that we control? But as you start thinking about now, how do we manage those same patients outside of the 4 walls of the health system? And how do we leverage community health workers, for example? How do we leverage faith-based organizations? How do we leverage our schools to help us in that care continuum? Again, different ways of thinking about it. So that's year one's curriculum. Go to the next page. So if you're applying for the program, you could apply for just the certificate, complete the certificate in up to 2 years, or you could apply for the master's degree right from the start, in which case you would complete the same first year curriculum that I just mentioned. And then we add on to that a second year of curriculum, again, 2 courses per term. So you could complete the master's degree in 4 years if you took 1 course per term throughout, or you can complete it in as little time as 2 years, as Anne mentioned earlier, or somewhere in between. So there's a lot of flexibility here. Again, we've built this around working professionals. I personally did my master's degree at night. It took me 4 years to do my master's. I did my doctoral training part-time, so it took me 6.5 years to get my doctoral degree. So I really approach this from the standpoint of you're a working professional. How do you do this so that you can better integrate, your professional life as well as your personal life and your school life? And so you could take 2 classes in term 1, you could take 1 class in term 2, you could take 1 class in term 3. You could adjust it based on, if you have a wedding coming up and you're going to be focused on a wedding, or you have something else coming up at work that you're going to need to focus on, you could adjust your schedule accordingly, as long as you finish it basically within the 4 years timeline. So in year 2, we've added on some additional coursework that looks at how do we think about population health and integrate some of the concepts of high-performing organizations. So this is built on the Baldrige framework. We look at health behavior in the community. How do we impact health behavior? Because obviously, if individuals aren't willing to change their behavior, improving health status becomes more difficult. We look at we have a course specifically helping us to take a big picture view of things, because as we think about making systematic changes that are going to help us improve health, we obviously have to take a systems approach to this. So we focus on that. We do a behavioral economics course, again, thinking about how do we leverage what we know about economics to influence behavior? How do we do value-based benefit designs, value-based incentives that, again, trigger the types of behavior that will lead to health improvement? We focus on the built environment because we recognize that so much of poor health is predicated on where we live, in the areas that we live in. So we look at incorporating that as well, taking an outside view, again, to the 4 walls of the health system. We look at leadership. Leadership is important for us to consider in a population health model, because again, if we're doing this as a true population health model where we're working collaboratively across sectors, that leadership approach is very different when you think about cross-sector leadership than what it is within a health system itself. And then finally, we have a course on social and cultural basis for community and primary healthcare, because that is sort of the crux of, in many ways, of where a lot of the care is going to be delivered and coordinated is through community-based and primary care types of activities. And then finally, we have an integrative activity. So for those of you who may already have a master's degree or have looked at other master's degree programs, every master's program requires you to do a capstone, a culminating experience, an opportunity for you to apply everything that you've learned through the program in this culminating experience. So in your final term of the program, we have an integrative activity in which you are asked to, apply what you've learned in throughout the program to this activity that we provide. So again, at the end of that curriculum, you would be ready to graduate in as little as 2 years, or as more, or upwards of 4 years. Next slide. So I think I've covered some of this already. Again, you could apply directly to the to the certificate program, or you could apply initially right into the master's program. If you apply directly to the master's, at the end of the first year, you automatically earn the certificate. Some students apply for the certificate because they want to see, one, just what the program is like. Is it going to be helpful? 2, how's it going to fit into my work life, all the other things that I have going on. So it gives them an opportunity to sort of test the waters. And if at the end of the certificate, you decide that you would like to go on for the master's degree, you have the ability to apply for that process. I encourage folks, though, because it does require a separate application. Everything you've done in the first year rolls over, so there's no need to repeat anything, but it does require a separate application. And so we do encourage people to, it's no harm, no foul if you apply to the master's program and stop at the end of the certificate. You can do that. So again, it's very flexible, but to avoid the need for a separate application, you're better off just applying to the master's program directly. Again, if you decide you've had enough after you've completed the certificate, the first year curriculum, you can stop there, and that would be it. This is very skill-based. It's a master's of applied science in population health management. And I underline that word applied because this entire program has been built, again, for the working professional, so that you actually are able to take what you're learning in real time and apply it. I get many, many emails from students. It's probably the best thing that I get from students in terms of feedback is how applicable this is, how they're able to take what we're talking about in class and actually apply it to what they're doing. So it's very much based on applied. But as the second to the last bullet implies, we've not only made it applied, and many of the faculty, as you'll see in a minute, are practicing professionals. So they're in the business and they're teaching for us part-time. They came out of healthcare, or they're in healthcare, much like I was. And so we're not only taking that practical knowledge and the applied knowledge, but we're balancing that out with the evidence. So what does the evidence tell us really works? And so we've melded those two together so that you're not only getting the evidence, but you're also getting the applied. So it's not just textbook kind of stuff. It's just not theory. It's theory that supports the application. And the application is leveraging the theory. So I think that's incredibly important about our program, is that we are taking a very evidence-informed approach to developing the curriculum that you're presented with, so that you can take it and actually apply it in real life. Next slide. So, Anne mentioned her title at the beginning, and she'll talk a little bit more in just a minute. But there are, any number of careers that are relevant to population health these days, particularly in health systems that are evolving population health strategies. Many of them have population health strategies that are focused more inward, looking at their attributed population, which is great. And then there are other health systems that have evolved beyond that. For example, at Advocate Aurora, if you want to look them up, a wonderful organization, one of many, of course, across the country, that have not only evolved their population health programs to focus internally on their attributed populations, but also grown that and expanded that to think outside of their four walls, to really engage as a community partner in improving health, or the health status of their community. So, this is only growing. Again, when we started this program back in 2016, when I put the initial proposal together and proposed it to the school, and it went from there, there was only really one other program in the country doing this. I think we were the second formal program to really offer a population health management focused program. And again, intentionally focused on not just population health management within a health system, but rather also providing a balanced view to say, how do we bring in what we know about public health and broaden that focus on population health management to a true population, looking at the community's health status. Next slide. Our school is, as Kelly mentioned earlier, has significant experience in online learning. This is a fully online program. It's an asynchronous program, if you want to think about it that way. But it's structured very much like you would find an in-person class to be structured, meaning there are weekly modules. So it's not just, sit down, listen to a bunch of recordings and take a test at the end. But rather, this is really an online course. So it's structured to provide you information as you progress through the 8 weeks of the term. There are assignments that are, spread throughout that. There are synchronous sessions. We call them live talks, but these would be Zoom sessions where everybody gets online and we talk about. I use it for my classes that I teach in the program to bring guest lecturers to meet with the students and talk about things in more detail. We use it to debrief things that we've worked on in terms of activities. So there are many opportunities, and Anne can speak to this, many opportunities to really engage with the instructor. So this is not a faceless, nameless kind of a program. We have done everything that we can to make this online learning feel like you are part of the program. And I think one of the things that I've been most impressed with has been the collaboration, the collegiality that has developed with the students in the classes and within the program, where they've actually developed, very close working relationships. You will do group projects, in many of the classes. And so you have the opportunity to not only learn from the faculty, but to learn from each other. Again, there are people out there in our program now that are CEOs of hospitals, for example, and they're taking this program. So they have a lot to contribute in terms of their own working knowledge of population health and population health management strategies. So it's not just the opportunity to learn from us, but to learn from people who are doing this real time in the program. And so again, I've been just remarkably impressed by how well our students connect with each other and really do facilitate and I think blossom, the opportunities for the program and for each other. Just some other quick things, there is a 24/7 help desk if you have technical issues. Of course, the faculty are always, present for you to reach out if there are course related types of issues. The help desk is really for technical types of things. I think, I've never had, knock on wood, 6 years of running this program, have had any complaints from students that they weren't being that their issues weren't being addressed in a very timely manner to the extent that they had any. I will say that the lectures are recorded, so you have the opportunity to download the slides, download the MP4. So if you want to listen to it in the car as you're driving to work, you could certainly do that. You can download the transcripts. So it's not just listening to me, but you have the opportunity at the same time that I'm talking to see the transcript come up on the side. So you could follow along as I'm talking. You can download the transcripts. So it's very technologically advanced from that perspective. Next slide. So the last thing I'll say, and then I think the real benefit of this presentation is going to be talking to one of the alumni. But our faculty, as I say, are not only interdisciplinary, but many of them are working in the field. I'll just pick Dave Baker. He's at the top of the list. Dave is the executive director for population health at a health system here in Maryland. So he's working this every day, but he's also teaching for our program, sharing his knowledge about assessing quality of care in a population health strategy environment. Again, I teach in the program. My name's not listed there, but I come out of the field as well and have done a lot in the ambulatory physician world. So population health has always been something very near and dear to my heart. Megan Priolo, just another example, is working for our regional health information system exchange, CRISP, here in Maryland. But prior to that was the chief operating officer for a very large and successful accountable care organization. So we talk about that a lot. And their organization that she used to work for just won the Baldrige Quality Award here in Maryland. So again, what we've tried to do is take not only, again, bringing faculty that have the research to bring to the table, as a Lygia or a Bill Brager or a Doug Huff would have, but we also have practitioners that are part of the faculty that help inform the curriculum, but also help, bring the real life attributes to this program. And so again, we cover all the different disciplines, but we also cover have faculty that are doing this, as I say, on a regular basis. I'll just point out Avia Siddiqui. She teaches one of our classes. She started as a guest lecturer for us. She's part of Advocate Aurora that I mentioned earlier. She's the vice president of population health there. So has significant experience, not only teaches one of the courses, but also serves as guest lecturers in other courses, just given the breadth of her knowledge. So I really can't speak more highly of the faculty that we have and the effort that they've put into making each one of our courses as applied as possible. But again, balancing that with giving you a good sense of what the evidence suggests. So with that, I'm going to turn it over now to Anne, who's one of our alum. As she mentioned, she graduated in 2020. It was the first year that we did not have an in-person graduation because of the pandemic. So Anne wasn't able to walk across the stage, but we did have a big virtual celebration for that year's classes. Unfortunately, the year after that as well, 2021. But it's great that we're going to be back in person again for our class of 2022. Which is also wonderful, to note that that we'll be graduating our fourth class, which puts us in excess of 120 alumni at this point. So we're very happy to have Anne here to share some of her thoughts.
And I'm very happy to be here to share them. So my background prior to this was not in healthcare. My undergraduate degree is actually in political science. I've worked for various tech companies over the years, and I found myself about 10 years ago starting work for this healthcare firm. And I was in charge of developing the software for healthcare systems to use. And I realized in speaking to doctors and nurses across the US that they were really struggling with the transition to value-based medicine. And I realized that to really do the best that I could in developing what we wanted to offer to the market, I needed to have a better understanding of it. And that's how I found myself looking at this offering at Hopkins, because, when I looked at what the curriculum would teach me, it really hit all the points that I was looking for. So yeah, if you want to go to the next slide, let's talk a little bit about why Hopkins. As I mentioned, I'm from Baltimore City, so I might be biased, but when it comes to Johns Hopkins, I don't think I am biased because, it's the top school of public health in the US. You can't go wrong with Hopkins, as far as that goes. So that part of the choice was very easy. As Dr. Bittle said, this is a unique program. I really couldn't find anything else that quite hit on all these pieces that I was looking for, plus that was an applied degree. As someone who was working full time, it was really important to me that I'd be able to take what I was doing in the classroom and apply it to my job right away, right? Because that just, that's what I was trying to get from this degree, and it's what I did get from this. The faculty were great. I can't say enough good things about them. As Dr. Bittle said, they're people that are also working in the field. So they have the theory and the academic piece of it, but that's married to the actual, now how do you put that into practice, which again was super important to me. The live talks, a lot of my classmates were not in the US at times. They either had to travel for work overseas or they were based overseas. And so it was really great that even for the live talks part of it, the way that they were scheduled, those folks were able to join sometimes, or at times when we couldn't join, you didn't get dinged for not being able to attend the live sessions. So there were times that I was also on travel for work. I couldn't make some of the live talks, but I didn't miss out on anything because they were all recorded and posted, within a few hours really of them happening, which was fantastic. As Dr. Bittle said, a lot of the professors use the live talks to bring other folks to speak to the classes. And so you have a chance to really dig a little deeper with some people that are doing great work out in the field. For some classes, the live talks really focused on, how did everybody do on the last test and where did we go wrong? So let's make sure everybody has a shared understanding of the concepts and all that good kind of stuff. The virtual model, not having to actually drive somewhere to go to a sit down class, really made this experience something that I could do. If I had to go to, I don't live that far from Hopkins, actually. It's probably about a 15-minute drive away from me. But if I had to go to campus 3 days a week to take classes and everything, that would not have been anything that I could have been able to do. And even though I'm based here in Baltimore City, like I said, most of my classmates were certainly all over the US, and really all over the world, which was a really fantastic experience for me. Because I don't work for a healthcare company, I work for a company that serves healthcare companies. Being able to really talk to doctors, nurses, people that are working within these health systems and hear directly from them what they're faced with, how they look at the world and how they're trying to work on these problems, really was incredibly important to my learning experience. Like Dr. Bittle said, while I learned a whole bunch from the professors and from the coursework, I probably learned just as much from my classmates and the work that we did both on group projects and just the way we work together throughout each course. So it is asynchronous, but it really felt like taking a regular class in the classroom, because there is so much back and forth, whether it's in the discussion threads or whether it's working on a group work. There's tools built into Course Plus, which is the software that Hopkins has to manage these courses to help you work together in groups. But a lot of the group work that I did with folks, we also did through WhatsApp, or we had our own Zoom sessions at times outside of the classroom. So I feel like I got the best of both worlds. So yeah. Next slide, please. It was a great decision. Let's just say that. Tips for success, managing your time when you're undertaking grad work while you're working full time is super important. And, Hopkins has a lot of tools built into Course Plus to make it easier for you to stay on top of things. You have the ability to download to your phone, in my case, all of the deadlines. So at the beginning of each class, from the very first day, I knew when everything was due. I could set, some little alarms to make sure I stayed on track with that. Again, as Dr. Bittle said, what was really fantastic is I could download the videos for each class, the transcript for each class, the deck for each class. And I honestly, I still have them and I still go back to them at times. I just made a folder for each class. I downloaded all the pieces for each class, all the things that we read for each class. And so I have it all now in my Johns Hopkins folder on my desktop. And that made it, really easy to stay on top of what was due each week, which was great. You're going to want to ask questions. Like, don't be shy. Like, everybody, is very open to helping you and to working with you, whether it's the professor, the teaching assistants, the folks that run this at Hopkins, and like I said, your classmates. So there's a lot of lot of people talking together both online in Course Plus and then also, offline through other channels. That connection with classmates, I think, is really an important thing. I'm not a very outgoing person, in case that's not obvious. So, for me, I really had to make the effort to talk to folks, and in some ways, having the discussion thread, being able to write something to get that connection started, made it a lot easier for me at least. The courses really build on each other. That I feel like the curriculum has been really well thought out, and it really kind of walks you through, step by step, thinking about these issues and ways to, look at these challenges that we're facing and overcome them. So the courses build on each other, and then of course in each course itself, the concepts really build as you go through those eight weeks. So, something that was pretty important for me, at least, was to kind of think about how the concepts from past courses really tied into the course that I was then taking in the next term, kind of thing. And I can't say enough about how great it was that I could really apply what I was learning immediately, like sometimes like the next day. Because again, for me, that was really something that I didn't want to wait the full 2 years to like learn everything and then sort out, well, how does this change how I'm doing what I'm doing? With the courses through this program, I was really able to take something like a tool that was covered in one class was a driver diagram. And so I took that literally the week we learned about it, and I made one for something I was working on at work, and I impressed the heck out of everybody. So that was really cool. And, it was really helpful for me to both for my learning to then, actually do it and see, oh, this is how it really works with things that, that I really know a lot about. And it made my job so much easier. So that was great. And the last thing I'll say, and this is something, like I said, I finished in the 2 years, and I'm almost sorry I didn't do it 4 years, just for the online access to journal articles. Maybe that sounds a little strange, but, being able to, dig in for free into all sorts of things that I wanted to learn more about was really a fantastic opportunity. And now, of course, I'll see a journal article that I want to read more about, and they want like $40 in order to read just one article. So that, everything I could possibly think about or want to learn more about, I had access to through the online library access at Hopkins. And that was a fantastic side benefit that I hadn't even thought about. So yeah. So there you have it. I'm happy to answer any questions at the end. Please put them in the Q&A.
Thank you, Mark and Anne, for sharing the need for these skill sets and details of the program. And Anne, thank you for sharing your experience with the program. I know that's really helpful for prospective students to hear someone who went through the program and the value you found and what you learned. So I'm going to touch on the admission requirements. We use Sophus. It's an application portal for the master's programs, and Sophus Express for the graduate certificate applications. All documents are uploaded in these application portals. We do require a bachelor's degree from an accredited college or university, looking for a minimum of 3 years of health-related work experience. You upload a resume or CV so they can see your previous healthcare accomplishments. The graduate certificate requires 1 recommendation letter. The master's program requires 3 letters of recommendation. You'll also upload a statement of purpose. This should show how your educational and career goals align with this program. And for our international students, you may need to take an exam for proficiency in English. And any education outside of the US would need to undergo a course-by-course evaluation, and we do recommend using WES or World Education Service. So as soon as your file is complete, it will go over to the admission committee. So they do ongoing admission decisions. So the earlier you apply and finish your application, the sooner you will get a decision back. File deadline is June 1st for the master's. For the graduate certificates, it is July 1st. We have one start each year. It is August 29th for this coming year. The current tuition is $1,270 per credit. Everyone who gets accepted into the program receives a partial OPAL scholarship of $488 per credit hour. There's no separate steps that you have to do to receive this OPAL scholarship. It is automatic. So it does bring the cost down to $782 per credit hour. So you would be looking at, for the master's program, $39,100, and for the certificate, $19,550. You pay for those credits or courses as you take them in each 8-week term. And beyond the partial OPAL scholarship, the financial aid office is there to provide assistance with federal or private loans. And you can see the contact information for the financial aid office, both their phone number and their email. So if you haven't typed in your question, please do so now. We'll try to address all questions. Some questions may be better answered by reaching out to you directly.
Kelly, while you're looking at the questions, can I just throw in a few things?
Yeah, absolutely.
Sure. Well, thanks. So, so first, I again want to thank Anne for being here and sharing her experiences. There's nothing, I think, more telling about a program than to talk to one of the alumni, and or current students, for that matter. The couple of things that she mentioned, though, that came to my head when she was talking. First and foremost is that you know, as a student, of course, you are assigned a faculty advisor. And again, from a faculty advisor perspective, it simply means that if you have a question that really you're not sure who to address it to, if it should go to the faculty member of a course or if it should go someplace else, you can always reach out to that faculty advisor, and as well myself. So, you know, I serve essentially as the faculty advisor for all the students in the program, as well. And so again, there's always someone to reach out to. And I say that in the sense that there's a real person behind the screen. So you should never feel isolated, you know, to some of Anne's comments. The other is, you know, we've done, I think, a remarkable job these last 2 years supporting our students, given the challenges that the pandemic has thrown our way, particularly since vast majority of them are in clinical, you know, health systems. You know, many people's time and energy have been, you know, redirected towards, you know, the pandemic response. And so some students have had to, you know, take time off of the program. And you know, I think Kelly and Anne both mentioned this, that you have the flexibility to do that. If you just cannot possibly think about taking a course in a particular term, you just don't take a course that term. You have to obviously make it up at some point, but you have the flexibility of just not taking something in a given term if something untoward is happening. And again, we're very flexible to work with you in that regard. And then the last thing I wanted to mention, which I didn't really speak to, is we do have a number, and Anne mentioned it, a number of students that are international, so Mexico, Canada, NHS, working for the NHS. I've been around the world, literally talking about population health, and it's a very applicable topic, even though many of our courses are probably more domestically focused, the U.S. healthcare system. The concepts, though, are very transferable to virtually any country, developed country that's looking at trying to adopt a population health management strategy. Why? Because virtually every developed country is experiencing the same things that we are. Increasing costs for the delivery of healthcare, and more challenging times to address the outcomes that we desire. So these concepts are readily transferable to other countries if you're thinking about this from an international student perspective. All right, so Kelly, back to you.
Thanks, Mark, for those additional comments. That was very helpful. Do you see the questions in the Q&A box?
I do, yes.
Okay, I don't know if you want to address I think we already answered that the program doesn't require any set login times. If you can log in for a live lecture, that's great, but if not, they are available recorded. Do you want to address that second question?
So that I'm looking at the one you're thinking about, is it, what's the question?
Yeah,
Is it anonymous?
Yes, I graduated from the MPH program in 2020.
Yeah. So yes, so just back to the first question briefly. These are asynchronous lectures for the most part. We do have synchronous sessions. Those synchronous sessions are typically in the evening. So again, depending on your time zone, for most people, it's available to most people depending on your time zone, but they are all recorded. So if you're not able to, they're there. You can listen to them at your convenience. In terms of the question, I graduated with MPH, great, meaning that you've taken epi and stats and the ethics course. Our school is fairly strict about accepting biostats, for example, from other schools. You do have the ability to test out of certain classes, biostats being one of them, but they're very specific about how that process works. So obviously, if you've graduated from this school, from Hopkins, with an MPH, obviously in recent times, 2020, you wouldn't, I would assume, not have to take the ethics biostats or ethics courses again. But you are sort of obligated to take the certificate courses to earn the certificate. It would be possible. I think we've done this maybe one time in 6 years, but it would be possible to take one of the other courses in the program in lieu of, because you still have to have the requisite credits. So to take one of the other courses from some other portion of the program. So what you're suggesting there about the second year would be possible. Again, we would have to get an exception so that you could essentially opt out of epi stats. The ethics course is just, that's not a problem, but so hopefully that answers your question.
And the next question, this is the DrPH question. Do you want to address that one as well?
So, the OPAL program, and this is largely due to the scholarship that's provided, is very separate from all the other courses in the School of Public Health, and it works both ways. So, for example, when Anne was a student, Anne could take any of the OPAL courses that we offered, obviously related to the program that she was in, but could not take a course that wasn't an OPAL course. So she couldn't take some other course that was offered by health policy and management if it wasn't an OPAL course. And the reverse is true. If you're an MPH student here or DrPH student and you would like to take my collective impact course, it's a bad example. Most of our OPAL courses cannot be taken by existing Hopkins students. Several of them, my collective impact being one of them, has a companion course that is open to any other student. If you're not an OPAL student, it's open to any of the other students in the school, but not all of the OPAL courses are like that. So again, if you had stats and epi already, again, those could be waived. They would need to be replaced, but you'd have to apply for the program. So as a current DrPH student, you just couldn't take the courses for the program itself. You'd have to apply to the OPAL program.
Thank you, Mark. The next question is asking if there's an opportunity for campus visits.
So we do not require as part of the program, and I know that there are some executive programs that do this, where they have a portion of your curriculum, if you will, is in person, where you come to campus for a week. Many, executive MBA programs, for example, do that, where you come to campus. It's sort of an immersive process. We don't require that in our program. Obviously, we have an open invitation to any student that's ever in town to give us a call and stop by. We'll give you a tour of the campus, et cetera. You can meet people in person, but our program doesn't require any in-person activities outside of the in-person activities that you'll do in a class that would relate to a group project.
Yeah, and I think you've touched on this next question. They're asking if you can take a class without being accepted in the program, and you do have to be accepted in the program to have access to the courses that are offered in either the graduate certificate or the master's.
Right, that's correct. You have to be part of the program in order to take the courses.
And this is for you. How many hours did the course take you in each week on average?
That's a great question. So it's very much like an in-person college class. So for most classes, there were around 3 hours of lectures to listen to each week, usually divided across, three pieces. Here's a helpful tip that I didn't share. I'm a fairly fast talker and I'm a fast listener. So actually I would play the videos at 2 times the speed. So it only took me half the amount of time to listen to the lectures. And that just worked best for me and my way of learning. Most classes have several readings to do as well. So depending on how fast of a reader you are and what kind of reader you are, some people like to print stuff out and mark stuff up because they learn best that way. Other people can read things online and they learn fine that way. I'm that kind of person. So for me, between the listening to the lectures, doing the readings, and then doing the assignments, there's usually at least one discussion post per class per week that's fairly substantial, that you need to do some research and some real thinking in order to post, and then usually either some sort of assessment through a quiz or some sort of written work that you need to do. I would say for me, for each course, I was probably spending maybe 5 hours on a regular week. If you manage your time well, the papers and the larger pieces that you work on across several weeks, shouldn't be that big a deal. If you are a procrastinator that can wait till the last minute to try to do things, which I do not recommend, but I'm also that kind of person. So I have to admit, I did do that upon occasion. You might find yourself, pressed for time in a week when something big is due. So I do not recommend that. But I certainly found it a very manageable to do 2 courses each term. A lot of people that were in my classes were only doing 1 course each term. So for them and for their schedule and their other responsibilities, that made more sense. I don't have any kids, I don't have any other things, weighing on my time. So for me, I could really make this my number 1 priority after work. So I hope that makes sense.
Yeah, and just to add to that real quickly, that again, there's a rule of thumb that basically for a 3-credit class, you can expect to do 6 hours outside of the classroom. So a 3-credit course would require about 9 hours of work per week, and that's all inclusive. So listening to the lectures, doing the readings, doing any assignments that might be due that week, and again, that's sort of an average. But that's kind of the rule of thumb that you can think about.
Yeah, thanks, Mark. That's what I share with students as well, as far as just the time to expect for each course.
And I will say that, again, the courses are rolled out methodically. So again, it's just not, here's everything, work through it at your own pace. We pace it out for you because we want you to not just rush through all the readings or rush through all the lectures, and but rather to really be able to absorb it, contemplate, reflect, and apply it. So essentially on a Monday morning, the week's module will open, and you have until Sunday night at 11:59 p.m. To kind of do whatever it is that you need to do that week. So listen to the recordings, do the readings. So it isn't like going to a class that you have every Monday from 12 to 3. You basically have the week to do that week's module. And so again, we've worked very hard to make sure that the amount of work that you have to do that week is consistent, as much as possible, spread out through the 8 weeks, and doesn't really exceed, where you have 25 articles to read and 6 hours of lectures. We just don't develop them that way. We want to make sure that, roughly between 6 to 9 hours of work is what it's going to take you to get through everything that you need to do that week. But as Ann said, don't procrastinate.
Yeah, really don't. That's a huge mistake.
It adds up quickly. Right.
And I will say, if you do decide to do it in 2 years or 1 year for the certificate, I found at least that the 2 courses I was taking at this, during the same term, the professors had talked to each other and had balanced it so that, we didn't have a big thing due in both classes the same week. It was, which would have been awful. So, I really was glad that there was a lot of communication about that. And by the same token, all of us are people who are working. And so professors were very understanding if you let them know in advance that you had like a work trip. So you were going to be out of town for a week. And so perhaps for that week, you were concerned that you wouldn't be able to get, something in at exactly the right time. I wouldn't ask for that all the time, but certainly the few occasions that I had to do that, professors were very, very understanding about that, or they were very clear in their policies about that, so that you at least knew, what was going to be the outcome. So.
Thanks, Ann. I think that was really helpful to hear for prospective students. The next question I can answer, the question is, do graduates from Canadian universities need English language evaluations? If your degree or degrees were taught in English, you do not need to take English proficiency exam. And Dr. Bittle, I think the next 2 questions kind of tie in demographics on the classes of the past couple of years, and then what is the acceptance rate for the program?
Yeah, so I don't have any specific numbers. We have our course, it's not essentially a cohort. I mean, we admit students once a year, so I sort of count that as a cohort. But as Ann said, students progress through the program at different rates. Some are on the 2-year path to complete the master's degree. Some are on the 4-year path. Some are somewhere in between. So you may not necessarily be in every class with the same people, but generally speaking, you know who you're in class with, throughout and the program. So we have students from every state so far in the U.S. We've had international students, as I mentioned earlier. In terms of the demographic, it's pretty much, I would say, similar to what our MHA, Master's in Health Administration program is. It tends to be more female than male. But in terms of professions, again, we've run the gamut from individuals that work in health systems, so physicians, nurses, pharmacists, a lot of pharmacists in recent years, a lot more pharmacists in recent years, administrators, people that may have gotten a master's degree in something else, but are transitioning into healthcare. And so they're looking to get a master's that's more in line with what they're planning to do. We also have, in terms of participants that are outside of the healthcare field, a number of them are in the insurance side of things, where they're working with insurance companies. Many large insurance companies now have population health departments. So we have some pretty high up alumni that have been in Aetna and Humana and Kaiser Permanente. Not that Kaiser's directly an insurance company, but they have a mixed model. And the same with pharmaceutical companies have actually population health management departments now, and looking at how to better manage populations vis-a-vis medical management. So it covers really the gamut, but I would say the vast majority, let's say 60% of our participants, are in the health system in some way or another. Again, we have a current CEO that will be graduating in May. We have a number of physicians, both primary care as well as specialty physicians. I'm actually giving grand rounds next week for one of our alumni who's the chief of medicine in a health system in New Jersey. So so hopefully that gives you a sense of the professions that you're looking at or thinking about. In terms of the acceptance rate for the program, our program again does require 3 years of work experience. So we do look at not only what you're doing or what you have done from a healthcare perspective, but more importantly, we're wanting to know what you plan to do with this degree when you're finished, because we really do want people in the program that are going to take what we're sharing with them and apply it. And really work to improve the health of population. So our acceptance rate is probably in the 35% range. Most of the reasons, the vast majority of reasons why people are not admitted are actually related more towards not having any experience at all, have no future desire to be in the business, or lastly, that their GPA isn't sufficient. And again, we kind of look at the GPA in a very holistic way, with particular emphasis on looking at how you did with quantitative courses. Biostatistics is not an easy course. And for some people, we may admit them, but say, hey, look, you really should brush up on your college algebra so that you do well in your statistics class. A lot of resources, again, available in the program or through the program for that once you're in. But we do keep an eye out for that for admitted students.
And Mark, this also ties in with what you just touched on. The question is, are there any prerequisite courses that would help with admissions into the program?
Yeah, so when we look at as I say, when we look at a transcript, we're obviously looking at the overall GPA that you have. We we recognize that if you only have an undergraduate degree, a bachelor's degree, we tend to focus on your last 2 years as opposed to your first 2 years, because we all know, I've been there too, you kind of figuring things out. So we tend to focus on the final 2 years of your degree. But we also look then at what kind of quantitative preparation you've had. EPI and biostats both are quantitative courses, and we have over the years sort of tightened our requirement there, just because we've seen how students have struggled with those courses in our early admission decision making. So we do look at the quantitative skills. So for example, and we have this example that, the person has an undergraduate degree that isn't in healthcare. It largely doesn't have any quantitative courses whatsoever, just based on the nature of their undergraduate degree, but they are working in the field. They are doing quantitative things. So we do look to see what kinds of work that they are doing, because they may have learned it on the job and not had it as part of their undergrad. So this is where the resume becomes very important. But in the instance that we are concerned that someone might struggle, then we do have resources that we share with the student once they're admitted, for them to work on. Again, college algebra refresher. If you haven't had biostats for a long time, you may not use it every day. You could, we have a couple of statistical courses that are free that students could access to just refresh themselves. So again, once you're in the program or admitted to the program, we reach out to students and share with them some resources that our faculty have identified that would be helpful in just brushing up on those skills. But we do our best as part of the review process to identify those individuals up front, so that once they're admitted, if they're otherwise, really good candidates, then again, we follow up with them to brush up on those things.
There's a question about after one finishes the master's in population health, any other graduate programs that would be recommended to continue their education?
We do have students, we have had graduates of the program apply for DrPH programs, both here, that they've been accepted here, as well as in other schools. So it all depends on really what your goals are, as to whether or not another master's degree would be important, or a doctoral level, education would be important. I really, that's up to the individual, and that's certainly something that we are constantly engaged with students on, to the extent that they have questions about that. They can certainly reach out to me as program director, their academic advisor, to talk about, career objectives and what programs make sense. Again, I know I get these emails quite often from students saying, I'm so happy I'm graduated, and I never thought I'd say this, but I'm looking to re-enroll in school. Here's what I'm thinking. Can you talk it through with me? And we're always happy to do that.
I have a question here on, in terms of additional cost, are there any additional fees required for software licenses?
No. So again, everything that you need to complete the program is embedded within the program and as part of your tuition. So there are no, our learning management system, Course Plus, is you would access to connect with all the things related to your course. Everything is in Course Plus. We've done a lot of work, as Anne mentioned, to not only coordinate across classes, but also to make sure that each class has a very similar look and feel to it, so that if you're looking for where the readings are, you're looking for where the lectures are, the setup of each of the courses is consistent throughout. So again, everything's there that you need, even within the biostats program or course that you take. So all of that's available.
Thank you for answering that question. Could you comment on the timeline for acceptance once a file is complete?
Oh, okay, I get it now. So yeah, so what happens is when you complete the application, once the application is complete, then it's turned over to the admissions committee. So we have 6 people that serve on our admissions committee. So 2 people are selected to review every application. So every application is reviewed by 2 reviewers who do an independent review of the application and make a recommendation. If there's an agreement to accept, it's processed immediately. If there's a discrepancy between the 2 reviewers, they get on the phone and they discuss the discrepancy. And oftentimes it's resolved and then it's processed from that point. We allocate 7 days from the day it's assigned to a reviewer to the completion of the review by both parties. So usually the longest time frame of all of it is making sure that all the elements of the application are complete so that it can then be turned over to the review committee. But once that's done, within 7 days, the decision is made, and then that information is distributed out from the registrar's office, usually within a couple of days from that. So typically within 2 weeks, you would know if you've been admitted or not.
Thank you.
I did want to, I don't know if anybody, so the one question about why choose this over an MPH. Again, I would argue that in many ways, and I'm the program director for the MHA. I'm very involved with the MPH program, and I would say that the MHA on one hand, you have the MPH on the other. The MAS in population health management has really taken the best of both worlds and combined them. And so I know a lot of health systems that require MHAs, or some more recent ones are requiring MPHs. But the population health degree is really the blend. It really looks at both taking things from a hospital health system perspective and how do we manage that attributed population better, and then also taking what we know from public health to say how do we work more effectively in the community. I think the value of the MAS in population health over an MPH is, and again, a lot of that depends on the nature of the courses that you take, but is really bringing in that healthcare perspective and healthcare management perspective to the patients, the patient side of things that you really, again, wouldn't get in an MPH program, depending on the types of courses that you take.
And I think one of the last questions, someone said, I may have missed this, but wonder if you could go over the types of assignments, the evaluation. They're asking specifically for the graduate certificate, but it would be the same for the second year of the master's program as well.
Yeah, so it's graduate school, whether it's certificate or the actual master's degree, it's both graduate level education. So in terms of methods of assessment, to put it in our lingo, it really depends on the nature of the course. Many courses, myself, I'll use mine as the example. I teach a couple of the courses in the program. You'll do quizzes weekly, and most of those are just knowledge checks to make sure that you're getting the content, that you're understanding the major concepts. They aren't weighted very heavily in terms of your overall grade, but they are important because we don't have the opportunity to necessarily see each other like we would in class. And I can tell by your face if you have a puzzled look that you may not be getting what I'm talking about. I can't see that, of course, with an asynchronous class. So I use quizzes that just test, are you getting the basic concepts? And I think most of the courses do something like that to just get a sense for that piece of it. But again, they're not weighted very heavily. Most of what you will do, again, biostats and epi are mainly tests-based classes. Of course, they're typically open book as well, so open note. But I would say for the vast majority of your formal grading, and again, Anne can speak to this as well from her recollection, are really essays, written papers and group projects that result in a written paper to talk about or really apply the material that you're learning in that class. So again, the goal of the whole program is to be applied, practical in nature. And we want to make sure that you understand the theory, the concepts, because you really can't apply things well if you don't understand the theory and concepts. So most of what we do is really looking at allowing you to apply the knowledge that you've gained. And the best way to assess that often is through written assignments. So very few classes out of the total that you take for the certificate and the master's as a whole have strictly just exams, tests that you would take.
Yep, I would agree with that. And I would say also that writing is a big part of it, like you said. But even for the large writing assignments, there's usually a presentation aspect to it. So for a lot of classes, you might work on a group project that turns into a written assignment, but then you also have to do a presentation to the class of that written work. So you're building skills and becoming more comfortable with presenting, these concepts and speaking about them, which again goes back to that applied aspect of it, which I very much appreciated.
It is a very, I think, comprehensive program as far as assignments and very interactive. It's what students have shared with me. And I do hear back from students after they've started the program and just with wonderful feedback. Last question, will taking a GRE help in my application if my overall undergraduate GPA is not great?
That's a great question. So from the beginning of this program, we elected not to require GREs. The school just recently did that, eliminated GRE requirements because of COVID and obviously testing centers being closed. And many programs are not going back to the GRE. So we don't require it to be submitted. If it's there, we look at it. And again, we call what we do is more of a holistic admission process. So we're not just looking for, did you check off the box 3.0 or higher, this, that, and the other, but rather we kind of look at it in its totality. If you had a 2.95, GPA, but you're working as the vice president of population health, and I'm, sort of making this somewhat egregious, but we're going to take all that into consideration. So I think, when we look at the transcript, obviously we are looking at the GPA as a whole, but as I said earlier, what we're really looking for is, the types of courses that you took. We have some students that were pre-med, and did a lot of the organic and organic trips up a lot of people who think they're going to be pre-med and wind up going into, another field because they, their grades in organic chemistry. But, we'll, again, if it's a technical class that requires math and, we try and look at that in a holistic way. Again, because we don't require the GRE, we never see it in applications, or we haven't to date seen it in applications. So we've relied strictly on the transcripts provided.
Well, that appears to be all the questions. Thank you, everyone, for all your great questions. Mark or Anne, any closing comments?
Well, I would just say, again, thank you for your time. We do appreciate your interest in the program. If there are, any questions, the information is here for you to reach out. We're happy to answer them. And look forward, hopefully, to seeing your applications. And I just want to thank Anne again for being here and sharing her journey with us. It's always great, again, I think, to hear from the alumni of programs more so than from the program director. And Kelly, thank you as well for your time.
Well, again, thank you everyone for attending today's virtual open house. If you have any additional questions, or if you're excited about starting your application, the information is on this last slide. Do reach out to me here to be of assistance with any additional information you need, or to assist with your application. Have a great rest of your day.